Okay, so get this right. Imagine AI analyzing your CT scan, but not just for one specific thing, for a whole bunch of potential issues, almost like you've got like a whole team of specialists looking at it all at once. That's kind of the future we're going to look at today with this research paper you sent over about foundation models in medicine.
Yeah, it's a fascinating shift, isn't it? Moving away from this whole idea of like needing a separate AI for every single like task in medicine.
Yeah, exactly. It's like trying to fix a spaceship with a screwdriver.
Right.
So this paper, it focuses on one of these new foundation models. It's called CTFM, and it's designed to be kind of like a multi-tool for radiology.
Yeah, and it's trained on a massive amount of data, right?
Right.
We're talking over 148,000 CT scans,
Wow.
which is key, right? Because the sheer scale of that data allows this model, CTFM, to learn like these really general representations of anatomy that it can then apply to all sorts of different tasks.
So instead of being like a specialist, it's more like a medical resident who's learned from seeing like thousands of different cases. But how does it actually learn? Like, how does it, that's a lot of information to process.
Well, so the researchers here, they use this really clever technique called self-supervised learning, which is, I guess you could think about it kind of like how a child learns to recognize objects. They're just playing with them. Like, they don't necessarily have labels. There are no instructions. They're just figuring things out through exploring.
Hold on, no labels.
Hmm.
So how does it know what it's looking at if no one is telling it this is a heart or this is a lung?
Right. So, and that's the beauty of self-supervised learning, right? Instead of relying on like these external labels, the model is actually learning by finding patterns and relationships within the data itself. And in this case, they used kind of a modified version of a technique called SimCLR. It was originally designed for analyzing 2D images, but they adapted it to work with these, I guess you could say, bulkier 3D CT scans.
So they adapted it to work with these like big 3D CT scans.
Yeah.
That couldn't have been easy.
It wasn't easy, no.
Okay.
And so instead of comparing, the whole image, they kind of broke each scan down into smaller 3D patches. I guess you could think about it like analyzing a really complex puzzle, but by focusing on the individual pieces first.
Okay.
And this allowed the model to learn these like much more fine-grained representations of the anatomy and capture the like really subtle variations that exist even within a single scan.
Okay, so it's learning the details first and then kind of figuring out how all those details kind of fit together to form the bigger picture.
Yeah, exactly.
That's pretty neat. But does this approach translate into better performance? Can it actually compete with those specialized models?
That's the question, right? And the results are they're quite impressive. They tested CTFM on a bunch of different tasks, and in a lot of cases, it either matched or even exceeded the performance of models that were designed specifically for those tasks.
All right, you've got my attention. What were some of the highlights?
Well, one area where it really shined was whole body segmentation. So that's the ability to accurately identify and outline all these different anatomical structures. And CTFM, it was able to accurately segment 117 different structures.
Well, that's like having an AI anatomy expert like on hand 24/7. What was that?
It also showed a lot of promise in tumor segmentation, particularly in like these really challenging cases, like tumors that are located near blood vessels. They specifically looked at tumors in the liver, the pancreas, and the lungs.
Yeah, those are notoriously tricky to detect, even for like really experienced radiologists. So CTFM is like catching things that might be easily missed.
It's showing a lot of potential in that area, yeah. And another area where it really excelled was head CT triage.
Okay.
And this is super crucial in emergency rooms. That's where doctors need to quickly determine if a head CT is normal or abnormal.
Yeah. So it can help prioritize patients who like need immediate attention.
Exactly. Yeah. Potentially saving valuable time in those really critical situations.
Right.
And beyond these more specific tasks, CTFM also showed some really impressive capabilities in medical image retrieval.
Image retrieval. What is that?
So imagine a doctor is looking at a scan with like a really unusual tumor. They could use CTFM to like instantly search a database and find other cases that have visually similar tumors, even if those cases are from different hospitals or like different research studies.
That's like having access to like a global library of medical images.
Right.
No more relying on memory or like just anecdotal experience.
Yeah.
But how does CTFM actually know which scans are similar? Is it just like comparing pixel by pixel?
It's much more sophisticated than that. So it's learning to represent these images in a like high dimensional space where scans with similar features tend to cluster together. Imagine like if you were to plot all the stars in the galaxy on a map where their position is determined by their characteristics.
So like similar stars would be grouped together, like forming constellations.
Exactly, yeah.
Okay.
And so CTFM does something kind of similar with CT scans, and that's how it can do these impressive retrieval tasks. When it sees a new scan, it knows where it kind of fits on this map, and it can quickly find its closest neighbors.
Okay, I'm starting to see how this whole foundation model idea could really shake things up in medicine. But before we get too carried away, let's zoom back in on how CTFM actually learns.
Yeah.
So the key to its success is how the researchers kind of fine-tuned that SimCLR technique we were talking about earlier. Remember how they broke down the scans into smaller 3D patches?
Yes.
Kind of like focusing on the individual puzzle pieces?
Right. So they trained CTFM to distinguish between different patches from the same scan, essentially teaching it to recognize the unique characteristics of each anatomical region.
So it's like training your eye to spot the subtle differences between, say, uh, like oak leaves and maple leaves.
Yeah, that's a great analogy.
Even though they're both leaves, you can still tell them apart.
Right, exactly.
Okay.
And this approach actually allowed CTFM to outperform even the specialized models, especially when it came to these segmentation tasks.
Okay, so it's not just about recognizing what things are.
Right.
It's understanding where they are and like how they're shaped within the body.
Yeah.
That makes sense.
Yeah, and this focus on like really fine-grained detail is what allows CTFM to be so good at those tasks, like identifying those really hard-to-see tumors in your blood vessels, or like accurately outlining the boundaries of a tumor for surgery or radiation therapy.
Okay, I'm definitely seeing the potential here. But I'm curious, those other tasks you mentioned, like tumor identification and head CT triage,
Yeah.
did those also benefit from this like patch-based approach?
They did, yeah. And it's important to remember that CTFM is a foundation model. So that means it's learning these general representations of anatomy that can then be like adapted to all sorts of different tasks. Think of it like a really talented musician who can play multiple instruments because they have this really strong foundation in music theory.
So the same underlying knowledge that helps it segment organs also helps it spot tumors and classify head CTs.
Exactly.
That's fascinating.
And the results were they were pretty impressive across the board. So for tumor segmentation, they focused on 4 particularly challenging cases: hepatic vessel adjacent, pancreatic, and lung tumors.
Wait, hepatic vessel adjacent. Those are the tricky ones we talked about earlier, right?
Yeah.
The ones that are hard to see because they're like right near the blood vessels.
Exactly, those are the ones. And so CTFM, when it was combined with this existing tumor segmentation framework called Auto3D-Seg, it showed like really significant improvements in accurately outlining these tumors.
So it's not just detecting the tumors, it's helping doctors understand the exact size and location, which is crucial for planning treatment, right?
Precisely. And for the head CT triage, they tested it on 2 large data sets. One's called SINO-CT and the other CQ500. And both of these contain, a mix of normal and abnormal scans. And even though CTFM wasn't specifically trained for this task, it performed remarkably well, even surpassing a specialized model called Supreme in some cases.
So it's not just memorizing patterns, it's learning something like more fundamental that allows it to generalize to new situations.
Right.
But we've got a lot more to unpack here. What about those image retrieval tasks you mentioned? How did CTFM perform in those?
Well, that's what we'll pick up next time as we dive deeper into CTFM's kind of uncanny ability to connect the dots between different CT scans and uncover those hidden relationships within the medical data.
Okay, you've definitely left me wanting more. I can't wait to see what other surprises CTFM has in store for us. Okay, so we're back and ready to dive a little deeper into this whole world of CTFM. Last time, we left off talking about all these different tasks CTFM can handle, from spotting tumors to sorting those emergency head scans. Really sounds like a game changer, honestly.
Yeah, it's showing some incredible potential, that's for sure. But the real question is, beyond those specific tasks, is it actually learning a broader, kind of like a deeper understanding of the human body? That's what takes it from being like a fancy tool to something truly revolutionary.
Okay, I'm all ears. How did the researchers try to figure out what was going on inside CTFM's brain, so to speak? Did they crack open the AI skull and look around?
Not quite, but they did perform some pretty fascinating analyses to kind of probe its inner workings. And one of the things they looked at was the stability of its embeddings.
Embeddings, right. Those are like the AI's internal representation of a scan, like capturing its key features.
Exactly. Yeah. Think of it as like a unique fingerprint for each scan. And what they wanted to see was how consistent those fingerprints were across multiple scans of the same patient.
Yeah, that makes sense. I mean, people's bodies aren't perfectly static, right? There are natural variations over time. And even just slight differences in positioning during a scan can affect the images.
Precisely. So they use this data set called WRITER, which has repeated CT scans of lung cancer patients taken over time. And what they found was that even though the raw images themselves might have differed slightly, CTFM's embeddings, they remained remarkably stable.
So it's not getting thrown off by those minor variations. It's learning something more fundamental and consistent about the underlying anatomy, which is essential if you're tracking something like tumor growth, right? You want to be sure any changes that are detected by the AI are real and not just some artifact from the scanning process.
Exactly. Yeah. That consistency is crucial for building trust in these systems, especially when we're talking about real world medical applications.
Right. Okay. That makes sense. So we've got stability, but what about interpretability? Can we actually pick inside and understand why CTFM is making certain decisions or drawing certain connections?
Well, that's the holy grail of AI, isn't it? Especially in medicine, We really need to be able to trust the reasoning behind an AI's recommendations. So the researchers here, they used a couple of really clever techniques to kind of shed some light on CTFM's decision-making process.
Okay, all right, tell me more. How did they manage to, crack open that black box?
So remember those embeddings we were talking about?
Yeah.
The AI's kind of unique fingerprint for each scan. Well, they use a method called a principal component analysis. It's also called PCA, to visualize those embeddings and see if any patterns emerged.
PCA, right. That's a way to like simplify complex data, right?
Right.
Like taking a multi-layer cake and looking at a cross section to see all the different layers.
That's a great way to put it, yeah. And what they found was that similar anatomical structures, things like the heart, the lungs, and bones, they tended to cluster together in specific regions of this PCA visualization.
So even though no one explicitly told it to,
Mm.
CTFM was automatically grouping organs based on their like visual features.
Right.
That's pretty amazing. Did they take this visualization a step further at all?
They did. So they actually mapped these PCA clusters onto a color space, creating sort of like an anatomical color code. Imagine like different parts of the body lighting up in different colors based on their anatomical properties.
Okay, I'm picturing like a human body as a rainbow.
Yeah, right.
So did this color coding, did it stay consistent across different scans, even with the variations between patients?
That's the remarkable part. It did, yeah. The same colors would always represent the same types of tissues or organs, regardless of like those individual differences. It's as if CTFM has learned this like universal language of anatomy, a way of representing the human body that transcends individual variations.
That's incredible. It's like it's not just seeing individual pixels, it's understanding the underlying building blocks of the body.
Yeah, it's really pretty amazing.
And this isn't just like theoretical, right? You mentioned earlier that CTFM can search for similar regions across different scans.
Yeah.
How does this color coding system play into that?
Right. So it's all connected. So remember those semantic concept searches where you can like select a region of interest in one scan and CTFM will find other scans with similar regions?
Yeah.
So they use this to further kind of like explore CTFM's anatomical understanding.
So like, for example, if a doctor selects like the heart on one scan, CTFM can find the corresponding heart region in other scans, even if those scans are of like different patients or were taken from different angles.
Exactly.
Yeah.
And it did this with remarkable accuracy, consistently identifying the correct anatomical regions across a variety of different scans. And to test this even further, they took it a step further. They tried a kind of like an anatomical connect the dots game.
Okay, tell me more about this game.
So they would select a specific point, like within the heart, on one scan, and then they would use CTFM to find the corresponding point on other scans,
Huh.
essentially like asking it to pinpoint the exact same location in different representations of the heart.
Wow, that's a tough challenge. So how did CTFM perform? Was it able to connect those dots accurately?
It was surprisingly good at it. It consistently identified the correct corresponding points, even when the scans were taken from different angles or when the patient's bodies were positioned differently. It really highlights how CTFM is building a truly three-dimensional understanding of anatomy. It's not just recognizing isolated organs, but it's actually understanding their spatial relationships within the body.
That's incredible. It's like CTFM is learning to see the human body the way like we do, understanding that the heart is always in a specific location relative to the lungs, the spine, and so on. But did they do anything else to try to understand what CTFM was focusing on when it was like analyzing these scans?
Yeah, so they actually developed a technique called saliency mapping, and this allows them to visualize which regions of the scan were most important in kind of shaping CTFM's understanding.
Okay.
So it's like highlighting the parts of a picture that the AI is paying the most attention to.
So what did those saliency maps reveal? Was CTFM focusing on like the right areas?
Yeah, the results were they were really fascinating. So CTFM was consistently drawn to these like key anatomical landmarks, things like the lungs, the heart, the diaphragm, the vertebral column, and the pelvic girdle. It's as if it's learned to prioritize the structural framework of the body, just like a sculptor might focus on the skeleton before adding all the finer details.
Yeah, it really does seem like CTFM is learning to see the human body through an anatomical lens, just like a medical student would. It's incredible to think that it's able to extract this kind of knowledge without any like explicit labels or instructions, just by analyzing the raw data.
Yeah.
But we can't get too caught up in the excitement, can we?
Right.
There are real world limitations to consider, right?
Of course. It's important to remember that as exciting as this research is, CTFM is still in its early stages. The researchers themselves, they acknowledge several limitations in their paper that need to be addressed before this technology can be safely and responsibly integrated into like clinical practice.
Okay, so let's talk about those limitations. What are some of the hurdles that still need to be cleared?
Well, so one of the biggest challenges is just the computational power that's required to like train and run a model as complex as CTFM. It needs like really specialized hardware and expertise, which may not be readily available in all research or clinical settings.
So not every hospital can just like install CTFM and flip a switch, unfortunately.
Not yet, at least.
Okay.
But as technology advances and costs decrease, these limitations may become less significant over time.
What other limitations did the researchers point out?
Another important consideration is the need for more extensive validation. testing CTFM on larger and more diverse data sets.
Okay.
The initial results are, they're very promising,
Mm.
but we need to make sure it generalizes well across, different patient populations, different clinical scenarios before it can be safely deployed in real world settings.
So it's like testing a new drug in a small clinical trial before releasing to the public.
Right.
We need to make sure that it's safe and effective for everyone.
Exactly. And even with really extensive validation, there's still the challenge of integrating CTFM into like existing clinical workflows. We need to think carefully about how to present its findings to doctors in a way that's clear, understandable, and actionable.
Right. A brilliant AI is kind of useless if doctors can't understand it or act on its insights. It needs to be a true collaboration.
Absolutely. And then there's the ever-present challenge of AI security, particularly, the risk of adversarial attacks.
Adversarial attacks, those sound a bit ominous. But what are those?
So it's a bit technical, but basically imagine someone intentionally manipulating the input data, the CT scans in this case, to try to trick the AI into making incorrect predictions or classifications.
So someone could intentionally alter a scan to make CTFM miss a tumor or like misdiagnose a condition.
Yeah.
That's a scary thought.
It's a valid concern, and it's an area that requires ongoing research and attention. As we develop these increasingly sophisticated AI systems, we need to make sure they're robust enough to withstand those kinds of attacks.
Yeah.
To protect patient safety.
It's like building a high security vault to protect the AI.
Right.
And make sure that it's making reliable decisions. So even with all these challenges ahead, it sounds like CTFM has the potential to like significantly impact medicine.
Absolutely. Yeah, it's a testament to the incredible power of self-supervised learning and a really compelling glimpse into the future of AI-assisted healthcare.
But as we've discussed, it's crucial to move forward cautiously and responsibly, addressing those limitations and prioritizing patient safety above all else.
I couldn't agree more. Balancing the potential benefits with careful consideration of the risks is essential as we kind of navigate this uncharted territory of medical AI.
Well, you've definitely given us a lot to ponder. But before we wrap up this part of our deep dive, I'm curious to hear more about what this technology means for the future of medicine as a whole. Like, what kind of world is CTFM like pointing towards?
That's a great question, and one we'll explore in more depth next time as we shift our focus from like the technical details to the broader implications of this groundbreaking research.
Okay, I'm already looking forward to it. I can't wait to hear your insights on how CTFM and AI like it might reshape the landscape of healthcare. Welcome back. So for this final part of our deep dive into CTFM, we've covered a lot, right? We talked about its performance on specific tasks, things like tumor segmentation and that his CT triage thing, and then even its it's kind of uncanny ability to just understand those anatomical relationships.
Yeah, it's really it's pushing the boundaries of what we thought was possible with medical AI.
Right.
But as we've been talking about, it's not just about the tech itself. It's also about how it's developed, how it's deployed, and ultimately how it impacts patients and the whole healthcare system as a whole.
Right. We can't get like so caught up in the coolness factor that we forget about the real world implications.
Yeah.
So let's kind of shift gears a little bit here. We've talked about those technical details, limitations, the challenges, but now I want to hear your thoughts on the bigger picture. What does CTFM tell us about the future of medicine? What kind of world is it like pointing towards?
Well, I think CTFM kind of offers us a glimpse into this future where AI just becomes like this indispensable tool for every doctor, not just radiologists. Imagine a cardiologist who can just instantly compare a patient's heart scan with thousands of others, right? And find cases with similar features or anomalies, or imagine a surgeon using AI to create a personalized 3D model of a patient's anatomy. That would allow them to plan and practice a complex procedure with incredible precision.
Yeah, it's like giving every doctor a personalized AI assistant, right?
Right.
Enhancing their skills and knowledge with the power of machine learning. And it's not just about like making doctors more efficient. It's about improving accuracy. It's about reducing errors. And ultimately, it's about leading to better outcomes for patients.
Exactly. Yeah. And, we often hear these fears about AI replacing doctors. But I think CTFM is like the perfect example of how AI can actually augment human expertise and allow doctors to focus on what they do best. Caring for their patients with, empathy and compassion.
Yeah, it's like the difference between a carpenter using a simple handsaw, versus a high-tech power saw.
Right.
Like both can get the job done, but the power saw allows the carpenter to work more efficiently, more precisely, and it frees them up to focus on the artistry and the craftsmanship of their work.
Yeah, that's a great analogy, and I think that's the key takeaway here, right? CTFM and other AI models like it, they're not meant to replace human doctors, but to empower them to provide even better care.
But with great power comes great responsibility, right? We can't just like unleash these powerful AI tools into the healthcare system without carefully considering like the ethical implications.
Yeah, you're absolutely right. As we move forward with medical AI, we need to really prioritize transparency, accountability, and fairness. We need to make sure that these systems are developed and deployed in a way that benefits all patients, regardless of their background, their socioeconomic status, or access to care.
Yeah, it's about like democratizing healthcare, making sure
Yeah.
that everyone has the opportunity to benefit from these technological advancements. And
Yeah.
it's not just about the technology itself, right? It's about the people who build it, the data it's trained on,
Hmm.
and the policies that kind of govern its use.
Exactly. Yeah, we need to move beyond beyond the hype and have some really honest conversations about the potential risks and the unintended consequences of medical AI. We need to make sure these systems are used responsibly and ethically, always putting the well-being of the patient first.
And that's where the open source nature of CTFM is so important. By making their code and data publicly available, the researchers are kind of inviting collaboration and scrutiny from the wider scientific community.
It's a critical step towards building trust and making sure these technologies are developed with transparency and accountability. Open science allows experts from all these different fields, from medicine, computer science, ethics, law, to kind of contribute their perspectives and help shape the future of medical AI.
It's like creating a global think tank dedicated to harnessing the power of AI for good, right? Ensuring that it's used to improve healthcare for everyone, not just a privileged few.
And I think that's what makes this research so inspiring. It's not just about the technical advancements. It's about the potential to create a more equitable and accessible healthcare system for everyone.
Well said. And on that note, I think it's time to wrap up our deep dive into the world of CTFM.
Yeah.
It's been a fascinating journey, right? Exploring the capabilities, the limitations, and those profound implications of this groundbreaking technology.
Yeah, it's been a pleasure sharing these insights with you and our listeners.
And to everyone listening, we encourage you to keep exploring, keep asking questions, and stay engaged in the conversation about the future of medical AI. Who knows what incredible breakthroughs are waiting for us just around the corner. Thanks for joining us on the deep dive.